Welcome to the ThinkData Podcast in partnership with Dataworks. And today I'm joined by Bill Snyder. He is the founder and CEO of Cylinder Health. They are a really interesting business. They are a gut-first virtual care platform, which actually helps employers and health plans tackle digestive health with personalized and clinically backed support that improves outcomes and lowers costs. Bill's obviously going to give us a real insight into fundamentally what Cylinder is, but he's come with a wealth of experience in this space. He spent a number of years with Humana, Virta Health before leading Vivanti as CEO, and he launched Cylinder towards the back end of 2021. And obviously, we all know what was going on in the world then. So I'm really interested to touch on some of the challenges which you may have had to overcome, and obviously what ultimately led you to launch a business in one of the most hectic times we've probably seen in recent years. So yeah, over to you. What inspired you to start a Cylinder? Because as I mentioned, gut first, digestive health. A lot of people say that obviously people's health and well-being starts inside. We obviously aesthetically look externally, but it actually starts with what you ingest and your digestive side. So really interesting that you are tackling that. So yeah, over to you.
Yeah, thanks for having me on, Alex. I think for us at Cylinder, our mission is to revolutionize digital health gut first, and so we felt that this was a really important and underserved space. I had seen family members, friends, loved ones impacted by just digestive health issues, and oftentimes the story is similar for those who have experienced these conditions, where you start feeling these symptoms that impact your everyday. You're going to different doctors, you're having different tests completed, and many of these conditions are a diagnosis by elimination. So that means lots of doctor visits, lots of time spent back and forth to different testing facilities, trying to figure out what's going on. And sometimes you can uncover the root cause, sometimes patients can't uncover the root cause. And so seeing the impact that it's had on loved ones and friends, I knew that this was a space that we really wanted to tackle. And it's a space that myself and my team are really passionate about.
Yeah, it's really interesting. I think you touched on something really relevant there about the kind of it's a problem we know it exists, but actually very few vendors or companies are specifically targeting that. So can you talk me through kind of, when you looked at you obviously had the idea, you knew there was a problem that needed solving, but talk to me about kind of some of those early growing pains and some of the things which you had to tick off first before you could think about growing and, building a team.
Yeah, well, you hit on one that's really important for us, which was kind of awareness of the problem, because people do know that it's a problem, but we're still educating the market on the size and scope. And so there's different estimates in terms of individuals impacted, but here in the U.S., GI is about $136 billion in annual spend. It impacts about 40% of the population in terms of chronic digestive conditions. We know it's a leading cause for emergency room visits across the US. There's high pharmaceutical costs tied to these conditions as well. So for us, a big part of this was leveraging third-party literature, good evidence that's been published in different scientific and clinical journals to show employers and health plans, hey, are you aware that the size and the cost associated with these conditions, not to mention the impact on the lives of individuals. So there was an education component there. And what's really exciting is we've kind of seen that inflection point where now employers and health plans are all recognizing this as a major cost category in an area that really is in need of innovative solutions like Cylinder to help support the members. So I'd say from the beginning, that was a big thing, was educating the market. And then for us, it's always been a focus on how do we make sure that we are creating an incredible experience for members. So it's an experience that we want individuals to enjoy. When you think about dealing with a chronic condition or with health issues, none of us enjoy doing that. That's difficult, that's stressful, that's a really painful process. So when we think about how we build product, we want to create an incredible experience for individuals that's easy and creates a joyful experience for them. And then the second one is how do we create evidence-based clinical outcomes at scale? So are we having an impact on those individuals? Are they feeling better? Are we doing something new and unique that's actually driving great outcomes? And so those are the things that we thought about as we started to build early on, educate the market on the problem, and then build a product that the individuals love, and that we can come back to the health plan sponsors and the employers and say, look at these great outcomes we've been able to achieve in your population.
Yeah, it's really interesting because you touched something very. They need to enjoy it, and actually, your model is pretty unique in the sense that you've not gone pure platform first or AI first. You've actually got real people involved in this, haven't you? So, for the people that haven't come across Cylinder, do you mind kind of in practice, how does it work? So obviously someone, obviously I know you're targeting the employers and obviously the health plans as well. So obviously there'll be some form of insurance or some form of involvement from their side. But at what point does Cylinder, I suppose, take control and what can a I say patient or someone who needs the platform, what does that experience look like?
Yep. Yeah. So to your point, we work today with large self-funded employers and health plans. So they're typically sponsoring the solution, and so they're making it available to their employees and the dependents, so their families, at no cost, which is exciting. They've said this is a big problem. You guys have great outcomes. We want to pay for this for all of our employees and their families because we
Wow.
see the benefit that
Yeah.
it can drive. And then so for our members who we wake up every day thinking about, their experience is, hey, all of a sudden my employer or my health plan is letting me know I have this solution at no cost to me. And so they'll find us through email campaigns on their company intranet site, variety of different messaging modalities. And then they can access us by web platform or via our app. And so everything that we provide is remote. And so very easy sign up process. They come right onto the platform. First thing we do is a quick clinical intake, and we do two things with that information. One, we assess the acuity of each patient. And then second, we build an evidence-based clinical pathway that's personalized based on each individual's need. And I think that's really the component for us that is unique, and it's difficult. Because when
Mm,
we're talking about how do we think about data, we're
yeah.
using data to personalize that experience and to leverage pattern recognition to say, hey, we can understand what type of clinical care will drive the quickest and the best clinical impact for you as an individual. And that is a live clinical model. So
Mm,
every time we get more information, we're refining it, whether that's information from the member to say, here's the symptoms I'm taking, here's the food I'm eating, here's the medications I'm on, or if that's a third-party lab that we're bringing in. We've got new blood work on the member. We've got a microbiome analysis on the member. It could be claims information that we're getting from a health plan, for example, to understand the member's clinical history. So we use all those components to continue to refine the model for the individual because it's just like you and I, our lives update every single day.
yeah, exactly.
And then we do offer a coordinated care team. So that's health coaches, registered dietitians, gastroenterologists, internal medicine specialists, and some other specialist care providers as well to make sure there's coordinated care around the member.
Interesting. And would you say, I know you touched on 40%, I think was your figure you mentioned at the top, will have some form of issue relating to this. Do you see that your platform or your product is managing the symptoms, the treatment of it? Is it trying to cure, or is it a bit of both? Does it give you, because I guess a lot, and speaking, this could be completely wrong. Sometimes my lifestyle issues, it might be actually things that are less medically and actually more lifestyle. So I suppose you have to strike that fine balance, don't you?
It's a really good question, and this is something that I think is, again, really interesting about the space. So we have specifically taken an all-comers approach, and so that means we are working with patients who come to us and say, hey, I've been diagnosed already with ulcerative colitis or Crohn's disease, and I've been working with the GI doc, and I've been on a medication for 5 years. And what I'm looking for is support in that treatment and maybe mitigating some of the symptoms associated with my medication. So that could be an example of a patient. It could also be individuals who say, hey, I've had chronic cramping for 6 months. I haven't been to a doctor about it. I don't even know where to start.
Oh,
So
okay.
really large variety in terms of acuity and in terms of what outcome they're looking for. And that's where that personalization gets so important. And so that's where we look at leveraging technology to optimize the triage process, understand the member, and then make sure that that clinical interaction is appropriate. Because you're right. If someone says, hey, you know what, uh, I've been having cramping, will see members and say, I don't know where to go, so I went and got scoped. When in reality, they might need medical nutritional therapy, and they might need to work with one of our registered dietitians who can say, hey, actually, you've developed uh, lactose intolerance, which is very common. Or we may see individuals that say, hey, we're presenting with things like blood in the stool, where we're going to be saying, hey, we need to make sure that we're getting you into a brick and mortar physician quickly, or we're ordering the right diagnostic test to understand what's going on. So it really runs the full spectrum of acuity levels. And then, so from that perspective, we do see individuals where they have a new formal diagnosis thanks to us. Maybe there's a new even medication regimen that we'd be prescribing and recommending and tracking. Or it might be we're doing things like offering cognitive behavioral therapy for patients with IBS, which is a clinically validated first line of defense against symptoms associated with irritable bowel syndrome. So it's a large
Interesting.
variety of tools that we have, and then we're using those specifically for each individual based on their specific need.
No, it's really interesting. You touched on something just earlier about the kind of all the data that's coming in is effectively like the models building. Obviously, for people here listening, the AI is becoming smarter, and then it means that you are being able to provide better kind of suggestions and personalization. But do you mind, and it doesn't necessarily be too technical, can you talk about the technology stack and kind of, because AI is, to a lot of people who may not be listening to this specifically AI focused podcast, is AI is not just ChatGPT. There's a lot more to it behind that. But talk about AI and automation in your platform, because I think that'd be really interesting for people to understand where it sits and kind of what point it takes over and what decisions it's making.
For sure. Yeah, I think for us, one of the things, especially in healthcare, when you're interacting with patients and treating patients, you do need to be very careful and cautious about how you're utilizing it. And so for us, we look at AI, first and foremost, we use it across the organization internally. So that we have a mandate across the company. We do training for our employees in terms of how can we all be utilizing different tools and leveraging AI to make us more efficient, from marketing to sales to product development. And then in terms of our actual platform, the way that we think about AI today and the way that we're using it today is largely pattern recognition, and then understanding best clinical guidance and most updated and relevant clinical guidance for these specific conditions. And so from that, we're leveraging, well-known clinical authorities like the AGA or the American College of Gastroenterology. So best clinical guidelines. And then what we're doing is we're using AI to serve that protocol to our care team members.
Okay.
And then it's our actual care team that are making the ultimate decision. So we still have our team that is the final authority on what care those individuals are receiving, and it's our care team that is still doing that communication with the individual. And so I'm very bullish on what we can do with AI and where it can go. But for us right now, that communication back to the individual and the final clinical decision is still very much our care team that are making those decisions.
Which I think is really important, because I think we're a long way away from AI making medical decisions for people, but equally I love the point that you're using it internally. So workflow automation, driving efficiencies, freeing you and your team up to provide better care is ultimately the vision of the business. But actually, when it comes to finding a patient and saying, who's reached the decision here, and well, it's actually an AI, I think I'd be terrified. But how do you control that messaging then? Because I think, AI is so powerful, and automation is obviously what's going to make your business scale and provide better services to more people. But how do you kind of shape the messaging around AI without making sure people think, oh, this is an AI company?
Yeah, I think for us, I think we've just been so focused on what we do with AI and then
Yeah.
sharing what we don't do with AI.
Yeah.
And I think for our members feel it too. They get to know our care team, and they know
Mm.
that it's our care team that is making those decisions, that is doing those check-ins. And so I think that they can feel that come through in the solution. And when we talk to our members, they absolutely feel that. And then to your point, the question is like, okay, how do we make them more efficient, more effective, more scalable? Because we still
Mm.
want them to maintain that relationship. And then it's those things like, okay, but we can use AI to look at the pattern recognition. We can serve up a bunch of different options for our care team members that they can override or utilize to say, yep, that looks like the best next step of care for this individual.
Mm.
And then the other thing is all these great tools, just like, AI scribes as an example, like great example of enhanced efficiency. We piloted those with our care team this year, and we saw so much more efficiency in terms of just the idea of you get off a call where we want our care team to be spending time when they're talking to an individual is listening to that individual, having that conversation, providing guidance, really being engaged with that member. And just like any of us, if you walk into a doctor's office and they're staring at their screen the whole time and they're focused on, I got to input everything and type it in, boy, that's a terrible experience.
Yeah.
Now with AI scribes, you can have that connection, you can have that conversation, you can go deep with that patient, and everything's captured for the chart. So we're also capturing all that data that's necessary to complete the next step of care. So I think that's a great example of where
Yeah.
AI has fundamentally shifted how efficient and effective our care team can be at scale.
Yeah, and I really like that. And you're completely right, isn't it? I don't know if you're the same as me, but you always know when AI is talking to you, whatever medium it is. If it's your bank, if it's it could be anywhere. And you think, hang on a minute, is this a human? And if it's something to do with my health, and I feel that I'm not getting that personal, genuine response from someone, it's a very stock. I know they're getting better, the AI agents, but I think that's also where you'd lose that. There'd be people less engaged with Cylinder.
For sure. Yeah, and our care team is so incredible, and they do build those relationships, and we do have those individuals. Like there is that trust that they then build with our patients, our members, and so that just facilitates the ability to create positive behavior change, and for individuals to be almost more excited about following the care pathway because they know that they've got a support team from Cylinder.
I'm interested to go back on something you said right at the beginning about, the sheer scale of this problem is evident. I think the 40% figure you mentioned, but a lot of what you were doing in the early on is trying to educate, there is a problem, but this is what Cylinder can do to help. Talk about that kind of messaging and that establishing product market fit, which I know a lot of people struggle with. Startups, they might have had really good rounds of funding, but they're kind of working on the fly to establish that PMF. When did you know, we've got something here? I think this is needed.
Yeah. So I think for us, using the third-party literature was a great way to frame the
The
problem.
education piece.
For
Yeah.
sure. There was other third-party studies that would show how different components of what we were doing could drive real outcomes. So we knew that different dietary interventions in these condition sets could really drive outcomes. We knew that your digestive health is highly correlated to your mental health and to other conditions as well. The idea being if you can solve the gut, you're solving a lot of different issues. So we really leveraged third-party literature, but for us, since the founding of the business, in our DNA, we have been dedicated to publishing results. And so that's been really important, that we want to continue to publish in peer-reviewed clinical journals. And so when our kind of like, hey, we know we've got something, is those early clients where we said, hey, what we really need is data. And we need to work with you because we're going to get our own data from individuals. We're going to be able to survey individuals. We're going to be able to show mitigation of symptoms. Hey, they're feeling better. They're more adherent to clinical protocols. But one of the things that we would really need access to show the impact is claims information. And that's what the employers and the health plans have. And so we've got great partners on both the employers and health plan side who have allowed us to say, hey, we're going to give you that claims information so that you can do some really deep analysis on the cost savings as well for the individual and for the plan sponsor. And what we've seen is incredible savings for individuals. We're seeing decreased rates of ER visits. We're seeing decreased rates in inpatient care. We're seeing better adherence to things like medication, great outcomes from individuals saying they're having a truly positive experience. They're experiencing symptom mitigation. But then what's amazing is we're able to publish on, hey, we're generating, in some cases, a 5-to-1 ROI on reduction of hard cost spending in 1 year, which is absolutely amazing. And these are, again, well-established clinical journals that we're publishing in. And so for us, that's been really important. And for the digital health space, for entrepreneurs who are trying to build a digital health company, showing those first core outcomes and being able to say, people use it, so there's a need. Number two, they love it and they're feeling better. And then number three, you're able to show cost savings at scale and publish that in a meaningful way. Once you hit those kind of three areas, that's where you really start to see the volume pick up.
Yeah, there's no surprise you obviously had that exponential growth, because once you start to get those data points, the case studies sales isn't easy in this space, but it makes it easier if you can reference tangible results that said health plan has seen, and these are some of the outcomes.
That's absolutely right. And so when we go in and talk to organizations about why they should bring Cylinder to their populations, because there's a lot of different solutions, there's a lot of different conditions, and health plans and employers, they're overburdened with this stuff. There's so many things out there. It's like, but how do you choose? And so to be able to come in and frame up, hey, here's the size of the problem. And now all we'll do is spend time talk for the next 45 minutes talking about peer-reviewed clinical evidence and the impact that we can have. That's a really powerful conversation. And that's what we hear a lot. People are like, man, when you can come in and just show your studies that are evaluated by third parties, it's
Yeah,
phenomenal.
absolutely. I'm really keen to look ahead to kind of, AI is obviously plays such a key part of Cylinder, and as it does with other organizations. But I think for Cylinder specifically, it's obviously very niche in its focus. But how big a part do you think AI is going to have in the organization as it grows? I know you talked about internally workflow efficiencies, obviously predictive health personalization, but fast forward kind of 12, 18 months, the rate kind of AI is going at the moment, who knows? But for you specifically, where do you think AI is going to play a bigger part?
I mean, I think it's going to be, it's a huge part of our business across the board. And I think for us, the only constraint for us would be the comfort level of our partners in terms of utilization of AI. And for that, again, we're always going to be very careful around the fact that we want to make sure that our individuals have the best clinical information and that we're providing the absolute best clinical care to every member that we serve. And we think that AI is a big part of that. And that goes back to, again, like when you think about the GI space, these conditions are widespread. They're nebulous. There's no single biomarker. So nobody comes in and says, I have, here's my GI condition. Here's my one biometric, the
Treat
one
me.
test, right? When you talk to primary care physicians and when you talk to gastroenterologists, they say the same thing. They're like, this stuff is really hard because you have so many different variables. And so for us, when we think about, man, if we can start pulling data from, if we start looking at disparate data sets and making those connections, and again, get really, really good at that pattern recognition to say, okay, Alex steps into our platform and we start to learn about Alex and we're like, yes, we have seen so many individuals that have similar symptoms. And you know what? We've seen what works extremely well, what works pretty well, and what doesn't work. Let's go right to the extremely well and let's kind of start getting you into that clinical workflow based upon our vast experience. That's really exciting. And that's where AI can do so much and can move so much more quickly than we could even 2 years ago in terms of
Mm.
leveraging that expertise.
Yeah, you touched on something really interesting around the pace at which you want to grow may not be in sync with your clients or your customers at the moment, because there's still that it's nervousness, reluctance, education piece, call it what you want, but actually you want to fly because you can see the benefits already. But do you feel a lot of your work is actually, I know you've got the data points, you've got the papers, do you think a lot of it is actually still on the education piece, saying actually, look, you got to trust the process, trust this, because this is what we could deliver if we had this?
I think I think our partners are very open to it. I think it's on us to show that we can maintain our incredibly high clinical standards and safety standards, and
Yeah.
that it's on us to prove out the thesis that we can even be more effective, more efficient, and provide even better clinical care with these tools. And so I do think, and we are seeing movement, we have great clients and partners who are very excited about that. But I do think that still comes back to be a leading digital health solution that continues to provide amazing clinical care while continuing to innovate and push forward. It always comes back to the proof point. Go back to data. What's the data say? Where's the proof? And so for
Yeah.
us, that's how we think about it. Is our job is to prove out the increased efficiency and maintaining those amazing clinical standards as we infuse more and more technology into what we do.
Yeah, no, it's great. It's nice you said that, because I think a lot of people, you run a commercial entity, and I think a lot of organizations are so focused on that kind of growth, 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 but actually they lose sight of, the reason you set the business up in the first place. And actually, that if you lose sight of that, then you're in trouble.
For sure, 100%. We've got these great patient spotlight calls that we do, where we, with our patients' consent, are able to share kind of these life-changing stories. And that's amazing. And for our team, right? For the people across the board, we got great team members in every aspect of the business. And if you're an engineer and you're there, writing great code, and sometimes you're like, okay, like, why is this different than writing great code for some other company? And when
Yeah.
you hear the impact that, oh, what I'm building is having a meaningful impact on people's lives, I think that that's something that's really powerful, and is something that has helped us build a world-class team, because a lot of the people that come to Cylinder are folks that have said, you get an interview with someone and 5 minutes in, they're like, hey, let me tell you about my GI experience. And people
Yeah.
get really open, because they're passionate about it. And they're like, this has been terrible. I want to build something better, a better solution for myself, for my family, for my loved ones.
Yeah, well, it's no surprise you've had the successes you've had, and I really, really appreciate you coming on. So I think the first and foremost, the niche you operate in, how you're harnessing and utilizing AI, but it's still with that personalization of a human. I think it's really nice and unique and good to hear. And for people listening here, I'm assuming they can hop on the website, and it's a great website, by the way. Everyone listening to this, hop on that. Can they see some of the case studies, get a feel for what the product is?
They absolutely can. Yeah, they can come in, get a tour of the product, get a tour of the case studies, learn more about what we do, and then there's an opportunity to contact us if they need more information as well.
Fantastic. No, Bill, it's been my pleasure to have you on this morning, and thanks again for all your time. It's been been a lot of fun and a huge amount of insight shared.
Thank you, Alex. I enjoyed it. I appreciate it.
Thanks, Bill.